Welcome to another eye-opening segment. Today, we dive into a complex yet crucial topic: infertility in Black women, rise in infertility in women, a medical conspiracy or what? This subject is not only significant, but it also carries a weight of unanswered questions, and today, we aim to address them. Our purpose is to shed light on this matter, to provide understanding, and to stimulate thought-provoking conversation. So, let's delve into this intriguing debate and uncover the truth. Before we dive deeper, let's first understand what we mean by infertility. Infertility is a condition of the reproductive system that hinders the conception of children. It's not just about not being able to get pregnant, but also about staying pregnant. It's a problem that touches both men and women, but today we're focusing on women. Common causes of infertility in women include ovulation disorders, which affect the release of eggs from the ovaries, uterine or cervical abnormalities, fallopian tube damage or blockage, often caused by inflammation, and endometriosis, where tissue that normally grows in the uterus implants and grows in other locations. Signs of infertility in women often revolve around irregular menstrual cycles, hormone changes, and health issues like obesity or eating disorders. It's vital to remember that these are not definitive signs of infertility, but potential indicators that should be discussed with a healthcare provider. With this understanding, let's now explore the rise in infertility among Black women. Statistics show a concerning trend in the Black community. The rise in infertility rates among Black women is startling. According to a study published in the American Journal of Obstetrics and Gynecology, Black women are twice as likely to experience infertility as their white counterparts. Yet, they are less likely to seek and receive infertility treatment. This disparity isn't just a matter of individual health, it's a community concern, a societal issue. Now, let's compare these figures with other racial groups. The Centers for Disease Control and Prevention highlights that Asian and Hispanic women have comparable rates of infertility to white women. So, why is the Black community disproportionately affected? The reasons are complex and multifaceted, intertwining socio-economic factors, access to healthcare, and even genetic predispositions. Now let's try to uncover potential reasons behind this rise. Is it a medical conspiracy, systemic racial bias, or a combination of various factors? Let's delve deeper into the subject. But before that, we'd love to hear from you. If you're finding this video informative and helpful, don't forget to give it a thumbs up. We encourage you to subscribe to our Vitality channel for more insightful content like this. Is there an underlying agenda or motive contributing to this increase? Let's explore. Infertility in Black women is an issue that's been rising for some time now. But why is this so? Could it be due to systemic issues like lack of access to quality healthcare, or is there something more sinister at play? Some suggest that environmental factors, such as exposure to harmful chemicals, may be to blame. Others point to socioeconomic disparities, which can limit access to fertility treatments. Yet, there are those who believe in a more covert cause, suggesting a medical conspiracy targeting Black women. While these theories may sound far-fetched, they stem from historical instances where marginalized communities were subjected to unethical medical practices. However, without concrete evidence, these remain theories. Unraveling the truth behind this disturbing trend requires rigorous investigation and open dialogue. The impact of this trend is far-reaching and deeply affects the lives of Black women. The battle with infertility can be emotionally draining, physically challenging, and socially isolating. The emotional toll this takes on Black women is unimaginable. It's a silent struggle, shrouded in self-blame, guilt, and societal stigma, creating a whirlwind of stress and depression. Physically, the journey through infertility treatments can be invasive, exhausting, and often painful. Societally, Black women face unique challenges, including cultural pressures and a lack of understanding and empathy. Turning to government response, efforts have been made to address this issue. Policies have been enacted, healthcare provisions have been expanded, and funding for research has increased. But the question remains, are these measures truly effective? Are they reaching the women who need them the most? It's a mixed bag. While some strides have been made, there is still much to be done to adequately address the rise in infertility among Black women. What then can be done to reduce infertility rates among Black women? There are various interventions aimed at reducing infertility rates among Black women. First and foremost, access to quality healthcare is a paramount solution. It's essential that women have regular checkups and screenings to detect any potential health issues early. This includes routine pelvic exams and Pap tests to ensure reproductive health. In addition, education on reproductive health is vital. Women need to be aware of the signs of potential fertility issues, such as irregular periods, hormonal fluctuations, and unexplained weight gain or loss. They should also know when it's time to seek medical attention. Lifestyle changes can also play a significant role. A balanced diet, regular exercise, and avoiding harmful substances like tobacco and alcohol can improve overall health and fertility. Lastly, mental health support is crucial, as the emotional toll of infertility can be overwhelming. Counseling and support groups can provide much-needed emotional relief. Now, let's tackle the elephant in the room. Is this a medical conspiracy or something else? The question remains, is the rise in infertility among Black women a medical conspiracy or a result of other factors? This question has stirred a lot of debate. On one hand, some argue that systemic racism in healthcare and a lack of access to quality reproductive health services are the main culprits. Others, however, point to a more sinister plot. They suggest that there's a deliberate medical conspiracy at play, a targeted attempt to manipulate the fertility of Black women. This perspective is fueled by historical instances of medical exploitation and malpractice, which have left a deep-rooted mistrust in the healthcare system. But then, there are those who propose that this rise in infertility is simply due to lifestyle changes and environmental factors, like diet, stress, and exposure to harmful chemicals. It's a complex and multifaceted issue, with no clear-cut answer. What's certain, though, is this. Regardless of the cause, the issue of infertility among Black women is a serious concern that needs immediate attention. In conclusion, this topic is not just a matter of statistics and debates. We've journeyed through the rise in infertility among Black women, examined potential causes, and explored the profound impact it has on their lives. We've also delved into the question of whether this is a medical conspiracy or a symptom of broader issues. The core message is clear. We must raise awareness and advocate for better healthcare resources and support. Thank you for joining this important discussion. Remember to like, share, and subscribe to our channel for more insightful content. Let's continue to advocate for better healthcare resources and support for all women.